Get moving this morning. Thank you, Arlene and Christian. Good morning. I am Michelle Martinez, and I'm the chair of the summit. So I'm pleased to welcome you to Making Connections, Move More, Eat Healthy, Orange County. With that being said, I have the great honor of introducing Mr. Dr. Milton Gordon, the president of Cal State Fullerton. Dr. Gordon has served as president of my alma mater since 1990 and has led Cal State Fullerton into its prominence as one of the nation's largest and most inclusive senior institutions of higher learning. Dr. Gordon?
Thank you, Michelle, for the warm welcome and for serving as the Summit Chair. I commend your efforts and success as a leading voice in promoting a healthier community. It is such a real pleasure for you to be serving in this capacity. And I must say, over the last weekend, we graduated over 8,000 graduates. And I want to tell you, we gave out 27 doctorates of education in our College of Education. At Cal State Fullerton, we strive to produce high-quality research, excellent relationship with our new communities, and an abundance of learning experiences and opportunities. Today, we have the pleasure of convening this important countywide obesity summit and make connections to ensure that Orange County moves more and eats healthier. Cal State Fullerton has had a long-standing commitment to ensuring a healthier community. We established the Center for the Promotion of Healthy Lifestyles and Obesity Prevention, and the center is under the helm of Dr. Sherry McMahon. And where are you, Sherry? Stand up, stand up. She is currently serving as the acting dean for the College of Health and Human Development. The center's mission reflects the needs of our community through education and outreach to children and families. The center has worked with schools and other community agencies to develop and test model health promotion programs and intervention, work to assess and evaluate existing programs and policies, and identify theoretical models and environments that can explain and influence behavior patterns across different high-risk groups. Our campus has also been involved in innovative research. For example, through a federal grant research at Cal State Fullerton, we've partnered with a university in Florida on research on the Prader-Willi syndrome. This rare genetic disorder causes people to have an insatiable appetite, often resulting in life-threatening obesity. This research can hopefully shed light on childhood obesity and lead to intervention programs to address this growing health problem. I think we can all agree that a healthier community contributes to the prosperity of our county, region, and state. Many studies have noted the link between participation in physical activity and improved academic performance. Studies have also suggested that focusing more on physical fitness and nutrition results in healthier, happier, and smarter children. A healthy community allows us to be more competitive and prosperous. More important today than ever, as we compete in a really global economy. I think today's summit is such an important step in promoting a healthier Orange County. We are pleased to partner with the Orange County Healthcare Agency, NUPAC, and health founders on this much-needed countywide dialogue. And it is really my pleasure to introduce Senator Lou Correa, a graduate of Cal State Fullerton and a proud Titan, through and through. Senator Correa serves as the chair of NUPAC. Bryce, will you please?
Thank you, Dr. Milt Gordon. Now, let's give this man a round of applause. He's one of my personal heroes. Having been a Cal State Fullerton alumni and a student here, I'm not sure it was 5 or 4 years ago that I was a student here, maybe 30 years ago. But the fact of the matter is, the true test is time. When you look at leaders of this institution come and go, and I can tell you under Dr. Milt Gordon, Cal State Fullerton has become a true top institution in the state of California, in many ways in the country. I often joke and call Cal State Fullerton the Harvard of the West Coast, but I think there's more truth to that than many people can really understand. Where else do you have a business school funded by private-public partnerships? Nowhere in the Cal State system, very rarely in the UC system. The numbers of individuals that graduate from this institution and the representation in terms of those that live in Orange County is unbelievable. Let's give them again a round of applause. Thank you, Dr. Will. Dolores, I really enjoyed that little exercise that you had this morning, a few minutes ago. But I have to tell you, as the father of 4 kids, trying to get them out in the morning, I did that 2 or 3 times already. Thank you very much. Obesity, health, clearly a major challenge for all of us as a society, as a state. You look at Obamacare, you look at the health challenges, budgetary challenges at the county, the state, federal level. This is one of the primary areas that we have to address. And so as a chair of the advisory committee in UPAC, I thank all of you for your work. But let me say that I'm going to challenge all of you to think out of the box, to think different ways of approaching this issue. As a policymaker, I'm always trying to figure out what we can do different, what different approach. About 2 months ago, I was on a flight coming back from Sacramento. And I sit right next to this young lady who's actually a heart surgeon from Orange County. She happened to be an individual that I met with the day before in my office. So we struck up a conversation, and of course, this was one of the topics, obesity. She told me, Lou, she said, let me tell you a story. She said, I have a patient, firefighter. Says a guy a year and a half ago was totally healthy. The epitome of a firefighter, which is, a guy very athletic, totally in shape, no health problems. Says, now he's my patient. Overweight, cardiovascular challenges, heart challenges. And she said, you know what his issue was? She said, his relationship with his spouse had changed. 2.5 years ago, his family situation had gone south. And because of that, his whole life, drinking more, eating more, had just gone off that path. And now he was a heart patient. And as I think about us today, well, we try to legislate. We try to ban sodas, and we have high sugar drinks, fructose, from our high schools. What's the unintended consequence? A lot of the athletic programs that we were funding from the sale of those sodas have been eliminated. Is that a step forward, or is that a step backwards? I'm going to answer. You answer the question. When I was growing up, we walked to school here in Southern California. It wasn't through snow or rain, but through beautiful sunshine. But we still walked and biked to school. We don't do that anymore. We're faced with more stress in our lives. We're faced with more complications, which leads to what all of us do. Think about my life, okay? Not a firefighter. I'm a 10 pounds heavier. It happened overnight. One of those guys on a 10 pound per decade program. But the point is an important one, which is that all of us have to think out of the box. It's not just about what you eat. It's just not about the health. It's about the holistic part of our lives and society in figuring out how we live healthier lives. That's a tougher one. Because I'll tell you, you take the soda out of the kid in the school, he's going to bring one with him. He's going to go home, he's going to have 5 of them. So how do you approach this thing? This thing being this major challenge that we have of obesity, what we eat, healthy living, and moving ahead. And that's the harder one, but I think it may actually be the easier one. If you go after the main problem, then the symptoms can be more easily addressed. I'm here to work with you. I'm here to applaud your efforts in the meantime of moving forward and getting things done. On a separate, if I could take a moment for a quick commercial, if I can do that. Dr. Mill Gordon here was asking me earlier, Lou, what's going on with the state budget? And again, health-related, funding of clinics, funding of programs here, Medicare, some of the others. Big challenges. We are coming out, I'm hoping, of the most severe economic recession since the 1930s. And we have felt it. We know it because our neighbors have lost their homes, are starting to pick up some jobs. A lot of those jobs are what? Low wage, don't come with health insurance. So again, we're coming back to this issue. But the legislature, we started to move ahead. We're going to probably vote on a budget in the next week and a half, probably about June 7th or so. And we're hoping to have a budget that will likely restore funding to higher education and a lot of the other programs that we think will be cut if we don't cut a deal. It's going to be a painful budget, I have to say, on all sides. And what we would call the Republican side and the Democratic side. And I'm hoping that if it's a budget that causes pain on all sides, politically, it may actually be good for the state of California. So I would ask you to, as citizens, my commercial is, listen to what's going on and be active by calling your representative and tell them to do the right thing, whatever you think that right thing should be. Thank you very much and enjoy the day. And again, thank you for caring and being involved.
David Bryce of the Healthcare Agency. I wanted to take a moment and introduce some elected officials that are here this morning. I want to thank them for attending our leadership breakfast. And I know I see Councilwoman Sharon Cork, if you could please stand. I also see Councilwoman Jeremy Yamaguchi. And again, thank you for your dedication and making this a top priority here in your community. With that being said, David Riley is the director of the Orange County Healthcare Agency. He's responsible for the overall direction and operation of the agency and leading 2,400 employees in fulfilling the mission of the healthcare agency. So David, please join us.
You know, I think of what I've learned this morning, and one of the things I've learned is I don't know my right hand from my left. And it's a wonderful exercise we have. You know, it's great to follow Cal State Fullerton graduates coming up here with Senator Torrio, also Michelle Martinez and Dr. Gordon. I had the privilege of graduating from Fullerton back in 1977 from the School of Business, and I'm really a proud Cal State Fullerton graduate. The Titans are really good. Now, I will even, as director of the healthcare agency, I will even occasionally hire people who did not graduate from Cal State. It's really my privilege to welcome you to the summit this morning, Move More, Eat Healthy. This is just such an important topic for us. I want to thank Cal State Fullerton for helping sponsor this event and for allowing us to use their facility. Specifically, I want to thank Sherry McMahon, the acting dean of the College of Health and Human Development. Dr. Gordon, I'd like to encourage you to take acting off of that title. I also want to thank Barry Ross and Michelle Martinez from NUVAC for really being the driving force and sponsoring this event and coordinating the activities. Just have done a great job. I know there's a lot of other people who have felt with this, and I'd like to thank all of them. For those of you who did not have the pleasure of attending the breakfast this morning, one of my best staff members, our Deputy Agency Director, David Zaleas, gave a superb presentation on the crisis of obesity here in Orange County and across the country. So I really want to thank David for his presentation. Donna Fleming, our Chief of Operations, also played a significant role in helping with that presentation. Orange County is a great place to live. We are one of the healthiest counties in the country, definitely one of the healthiest counties in the state of California. In a recent health survey, we were ranked 7th out of 58 counties, and we were the highest ranked urban county in Southern California for a variety of health measures. So we're certainly an oasis of good health in California. We have one of the lowest smoking rates in the world. We have less people smoking here per capita than almost anywhere else. We have fantastic weather. We have great natural resources for opportunities for exercise. 42 miles of coastline, 50 square miles of county parkland. In terms of eating, farmers markets are sprouting throughout Orange County that provide many opportunities for healthy eating. Yet in the midst of plenty here in Orange County, we have an epidemic. It's a silent epidemic, and it's the epidemic of obesity. As David mentioned this morning, over half of the adults in Orange County are either overweight or are obese. Over half. 16% of our children are clinically obese in Orange County. 16%. 1/3 of the children born in Orange County in this decade are estimated to develop diabetes at some point in their lifetime. And diabetes is directly related to lack of exercise, being overweight, and poor eating habits. Today is a call to action. We talked about it at the breakfast this morning. We've been studying this issue in the healthcare agency. The community has been working hard on it. But today is a call to action to fight obesity in Orange County. The fight against obesity is the single most important thing that we can do to improve the health of Orange County residents. That's the big one. It's the 300-pound gorilla, literally. I encourage you to look for ways that we can change the trajectory of obesity in this county. I know a lot of you have worked on a lot of very creative programs. At the healthcare agency, we're working hard on this issue. There's many creative programs out in the community. Our Women, Infants, and Children's program serves over 35,000 low-income mothers and children with nutritious food and with nutrition education to improve health. We have a number of programs that are underway to increase the amount of breastfeeding in Orange County, which is an action that is critical in establishing good nutrition and reducing obesity among children. We've launched a new and creative program, fit cities that works with local governments to create and support policies that promote healthy living and active living. And as I mentioned earlier, there are many other creative programs that are going on out in the community. But in spite of those efforts, it's not enough. So much more needs to be done. I'm truly inspired by Mr. Salelas' presentation this morning, but also inspired by the wonderful attendance at this conference today. And each of you represent many others out in the community that are going to work hard on this issue. We at the county, but also with our community partners, are committed to making this a high priority within Orange County to attack obesity. I encourage you to enjoy and learn from the exhibits, from vendors and other information we have. I think we have 30 different exhibitors on different programs, which I think are excellent. And just closing, want to repeat, this is a call to action. And thank you for attending, and hope this is an enjoyable conference. Thank you.